Hi, my name is Trevor Irby, and today I will be talking about conventional medicine versus alternative medicine and why conventional medicine is the way to go. Due to a variety of reasons, alternative medicine has once again become a topic of controversy. Alternative medicine has become so vast it is impossible to discuss all of its therapies and techniques. Therefore, this video will focus on acupuncture therapy, chiropractic treatments, and herbal remedies. Therapies for alternative medicine tend to focus on the patient and not the symptom or disease. Instead of identifying symptoms and prescribing standard drugs, alternative practitioners take into account that the heart, body, and mind all need to be treated. This tends to lead to a holistic approach of medicine. There has been relatively little to no scientific evidence supporting alternative medicine. Yet, people keep falling victim to the myth that this path should be taken over conventional medicine. Conventional medicine is what is known as mainstream medicine. It is based on science and relies heavily on pharmaceutical medication. Some examples of conventional medicine consist of drugs, surgery, and radiation. Alternative medicine is when non-mainstream methods such as acupuncture are used in place of a conventional treatment. Conventional medicine, which falls under standard care, is what medical doctors of osteopathy, and allied health professionals such as nurses and physical therapists practice. On the other hand, alternative medicine, which is not regulated by the government, is the term for medical products and practices that are not part of standard care. Instead, it is used as a replacement. Acupuncture, one of the oldest alternative treatments, began in China as part of the traditional Chinese medicine. This treatment consists of inserting needles in various points throughout the body. The theory of acupuncture is based upon the concept of qi. Qi is a life force in a person. If you are alive, then you must have qi. The theory of this treatment is that if there is too much or not enough qi in a certain area, then an illness can result. It is said that the needles are used to balance the amount of qi at certain points. What many individuals do not know is that not all the needles used are thrown away. Some are reused over and over, but if not properly sterilized, infections can occur. An acupuncturist is said to be able to relieve pain, nausea, stress, and even headaches. Although there is research to support these claims, there is not significantly as much research to support conventional medication treatments. Now I would like to turn your attention to chiropractic treatments, which has recently been recognized as more of a mainstream practice, which involves manipulation of the spine. Chiropractors adhere to the belief that the spine is at the center of the patient's health. They manipulate and adjust the spine in order to relieve discomfort or pain. Many patients who visit chiropractors do so because they have back problems or have been in an accident related to injury. Chiropractic treatment seems to work for a short period of time, but you must keep going and going to get that relief of satisfaction. Is it really worth it? You tell me. However, now many chiropractors have started to use other treatments like applied kinesiology or reflexology in conjunction with spinal adjustment. Kinesiology is simply the study of mechanics of body movements. It addresses the biomechanical and physiological mechanisms of movement. It was developed in the 1960s by an American chiropractor, Dr. George Goodheart, D.C. Reflexology has to deal with massaging used to relieve tension and treat illness based on the theory that there are reflex points on the feet, hands, and head linked to every part of the body. This originated in Europe and is similar to chiropractic treatments. Instead of manipulating the spine, reflexologists manipulate other points on the body, as I mentioned before. Again, like I mentioned earlier, there has been relatively little to no scientific evidence supporting this alternative treatment. However, it is still a popular choice. Another prominent trend in alternative medicine is the use of herbal remedies and supplements. Like other therapies, herbal treatments involve a holistic approach. These really deal with the effects of changes in one's diet or exercise. Instead of resorting to alternative medicine, there are other actions that can be taken to promote health, such as eating a healthier diet, exercise, and drinking the proper amount of water. The industry of alternative medicine is growing rapidly today for a number of reasons. The increasing number of chronic illnesses, the aging of the baby boomers, and the concern about the environment have all contributed to a heightened awareness of alternative therapies and treatments. Many of the new followers of alternative medicine are unaware and uneducated on what the underlying factors really are. Hopefully from this video and doing more research on your own, you know that not all alternative therapies work and a small number are even dangerous. In fact, experts tend to categorize the therapies into three distinct sections: validated, non-validated, and invalidated. The two forms of alternative medicine that I have talked about already, acupuncture and chiropractic treatments, are both considered validated. This means that the therapies have been proven to aid in some pain or illness. At the same time, it is important to realize that some chiropractors and acupuncturists, many of the practitioners, are not regulated or even licensed. Now, the second section, the non-validated therapies, have not been proven harmful, but they have not yet been proven helpful either. Yet again, it is still a popular choice. Some examples, which I've already mentioned previously in this video, consist of therapies like herbology and applied kinesiology, which are examples of therapies which are termed non-validated. These therapies have been scientifically proven completely worthless or even harmful. Crystal and ozone therapies are examples of invalidated alternative medicine treatments. As mentioned earlier, the different alternative methods vary widely, but they all have some common characteristics. They are all based on a holistic approach to healing, which means that the therapy involves the body, mind, heart, and spirit. Alternative medicine also endorses the idea that improving the emotional and mental states of a person can prevent further physical illnesses. Yet again, this is not scientifically proven. Since alternative medicine uses individualized treatments, there are very few scientifically accurate studies done on alternative medicine. Alternative medicine itself simply relies more on anecdotal evidence and personal testimony. Where's the data? Show me the data! As a science major here at CUCA, this is one of the first things that we learn as freshmen. Where is the data? For instance, statistics are relatively rare in alternative medicine. This alone proves that alternative medicine is not the right path to go. Each year, the number of people relying on alternative medicine grows. In the year 2000, Americans spent more on alternative treatments than on conventional medicine, which included doctor visits, hospitalization, and prescription drugs. Another reason that I believe alternative medicine has been increasing is due to the fact of pricing. Unlike many other therapies, the cost, for instance, for acupuncture is reasonable. The average cost for an initial visit is about $60, and the follow-up is usually around $30. Although alternative medicine has certainly enjoyed success, thankfully, there still remains the question of where is the proof. Today's society puts more faith in scientific studies and experiments. Most of the supporting evidence for alternative medicine is not based on a scientific method, so it's not considered valid as conventional or traditional medicine. The main thing that I really want you to take out of this is that conventional medicine is evidence-based with scientific studies to support its claims. It uses the biomedical model, which means that there is a physical cause underlying all diseases. Contrarily, alternative medicine believes that the cause could be related to the body, mind, or spirit. I'm not here to tell you what to do. Just as with anything else, no one should automatically accept or reject everything. But I hope you were able to learn and take something out of this video. Ladies and gentlemen, thank you for watching this video. I hope you liked it. If so, please like it, share it with your friends, share it with your family, subscribe, follow, ask any questions. I will definitely comment and get back to you. Thank you very much. Trevor Irby out.